As we rearranged our lives to accommodate an uninvited virus, few aspects of life were untouched. From visiting the grandparents to trying to find toilet paper, everything was in upheaval, and so it was for our entire education system. Clearly, coronavirus was too cruel for school. With no lead time, no warning, teachers, parents, and students were left scrambling. 3 months of improvisation that put a whole new twist on the concept of substitute teaching. Shelved sports seasons, canceled proms, and strange virtual graduations got a lot of the attention, but it was more than that. What was the impact on learning? What was happening to our kids' psyches and their social development? We turn the corner to a new school year, and those very questions linger more urgently than ever. Frustrations erupt over a lack of answers and over divisions about the best way forward. Tonight, the answers we can find as of August 13th, 2020. We'll go to health class. What's the latest medical advice? We're in home ec. What are working parents to do? We'll be in the computer lab. What can we do about the digital divide? We'll attend study hall. In class or out, how do we make sure our kids are learning? And we've got calculus. How in the world will we equitably fund our schools in a school shuffling pandemic? Not all schools are ready to open, but ours is. It's our live town hall on Click on Detroit. Good evening. Thank you so much for joining us for our Education for All Town Hall. I'm Devin Skillion.
And I'm Paula Tutman. We have a Zoom screen full of major decision makers when it comes to how your children will return to learn this fall. Now, this is a crucial week for school districts. The calendar says they have until Saturday, August 15th, to turn in their back to school plans. But they really only have until Friday. No matter how you cut it, this is the 11th hour for districts.
And as we have every day for months, let's first consider the numbers. As of today, the state of Michigan has had 392 confirmed cases of COVID-19. 6,289 Michiganders have died from the virus. As the disease continues its spread, parents and students still trying to get answers to these basic questions of how education is going to work this year.
Yeah, indeed, for sure. And if you go to Rochester Community Schools, your first day starts 20 days from now. Detroit Public Schools Community District, easy for me to say, right?
Right.
And your start date is in 25 days. Whether you are in Ann Arbor or Southfield and you start the year completely remotely, or like Novi in Detroit, you have in-person options. We know you still have questions.
So instead of just hoping you can knit together the information yourself, we're going to give you access to the decision makers tonight.
Absolutely. We've been collecting your questions, and we're going to take them directly to the source.
So you can see we are really testing the inputs of how many you can get on one Zoom screen.
Let's see how this goes.
First, let me mention the superintendents that we have joining us tonight. Nikolai Vitti, the superintendent of the DPSCD school system. Dr. Wanda Cook Robinson is the superintendent of Oakland Schools. She's with us. Dr. Randy Liepa, Wayne Risa Schools superintendent, and Michael DeVault, the Macomb Intermediate School District superintendent. We also have with us tonight, and we'll be going to them throughout the evening back and forth. So because as the questions come into us, we want to make sure that we're going to the source that's best suited to answer it. Representative Pam Hornberger is with us. She is the chair of the Education Committee in the House. We've just reported earlier this evening, the Senate is going back into special session coming up on Saturday with whether or not we should be forcing in-school learning.
Also, Terrence Martin, Detroit Federation of Teachers, and of course,
our Dr. Frank McGeorge is here as well. So all here to answer your questions. Let me start, if we could, with Dr. Nikolai Vitti. Give me a little bit of a thought about where we stand right now, Dr. Vitti, from your perspective, as you watch the entire system trying to cobble together right now their own answers. Is that going to work? Can everybody move at the speed at which they want to, or would we be better off all moving together?
Good evening. Thank you for having me, and I look forward to the conversation with a great panel. You know, none of this is easy. I've been doing this for 20 years as a teacher, principal, superintendent. I've never faced something as challenging as this as a person and as a professional. None of this is ideal. We have so many contradictory guidance from the federal level, at the state level, There's great anxiety and fear among our employees, our families. But, I can only speak for DPSCD. We're doing everything we can to create a plan that empowers parents to make the decision that they think is best for their children as far as face-to-face or online. Obviously, if the governor at any point feels like the COVID numbers are too high to open up schools, then we would abide by that. And that goes for the state or local health department. If either entity, which is the empowered medical experts in this situation, say that it is too dangerous to open up schools, then we'll abide by that. But I think it's important for DPSCD to be nimble and flexible with its plan so that we can move accordingly based on the guidance and requirements put forth by the federal and the state government.
Yeah, that's a lot. Devin, you had a lot of good questions in there, but I'd also like to go to Dr. Wanda Cook-Robinson, who's the superintendent of, for all intent and purposes, Oakland County Schools. It's Oakland Schools. Dr. Cook-Robinson, I'm curious to know your thought process in all of this because we are that close.
This is a shifting landscape. In fact, a week ago, I could have told you that the majority of schools in Oakland County would be starting face-to-face instruction. However, a week later, the majority are doing the virtual instruction to students. What we're finding is that one size does not fit all. The communities have different levels of risk in the environment, and each community in Oakland has surveyed their community. They have talked with their teaching staff, and it's those components that have helped them to make the decision of how they needed to start school.
Let me bring Dr. Randy Liepa in here from Wayne Reesa Schools. Randy, I'm curious as to when you are all as superintendents talking with each other, and I know a lot of these conversations have been going on, do you find yourselves all in general agreement, or are there some sharp divisions here that you think might be tearing apart a uniform approach?
Yeah, actually, the agreement is on the most important things, which is we hear from superintendents and everybody in the education field, they want kids back in school. That is first and foremost what they know will provide the best education for students. And it actually, that's universal. Where there's a difference, and it's a bit of what Dr. Cook-Robinson said, where there's a difference when it comes to their ability to implement the safety guidelines that were identified in the roadmap at the state level. And so I think the real struggle for school districts has been they want to get kids back at school in every way that they possibly can, but they just can't implement the safety recommendations that were outlined through the roadmap, and that's where they're struggling.
Yeah.
Yeah, I've had a lot of conversations with these superintendents, including Michael DeVault, and he's with the Macomb Intermediate School District. And so we'd like for you to weigh in while we're talking to our superintendents for this part of the roundtable.
Well, thanks very much for having us here. It's a real delight to be here. I have similar comments. I'll answer it this way. We have unanimity here in terms of in the county. The superintendents and school districts have been working together for months and weeks and trying to find solutions. We've explored all the options and tried to include everybody in that discussion. We've got great cooperation from our county executive, Mark Hackle. We purchased all the PPE stuff we need for all 140,000 students. They're in the school districts now, ready to be used. We've had great cooperation from Dr. Lokar, our county health doc. So I would have to say it's the same kind of situation, trying to face this, trying to find the right balance in balancing face-to-face, hybrid, and also a remote option. So we're all working through that, trying to make the best decision on behalf of both the safety of our employees, but more importantly, how we can best give opportunity to all the students to achieve whatever they can in this awful situation.
We in the newsroom keep talking how every day it's like trying to take a sip out of a fire hose. The information, every day there's a new study. Yeah. Every day there's a new recommendation.
New information.
Nikolai, I'm curious as to whether you find your opinion of what you should be doing changing day by day, week by week, or has it stayed fairly consistent for the last month or so?
It's been consistent. I think we're still awaiting clarity from the state regarding funding, a possible requirement for face-to-face, looking at how attendance will be taken, FTE. So those are, I think, probably some of the most significant questions. But I think the data that we're looking at more than anything else is the infection rate in the city. So after about a 7-day average going into at least Saturday, we were at a 2.7 infection rate in the city. And most experts are saying anything between 5 and 10 is too high. In fact, the American Federation of Teachers at the national level has said schools should not open if it's beyond 5%.
Yeah.
And so that's the number we're looking at most closely. You know, if I were in Miami right now, or many large urban school districts in Florida, I'd be the first one calling for the closure of schools. That rate is too high. But at some level, we have to be consistent if we're going to use science. Most science is saying, if you want to call it in those generic terms, is that you shouldn't fully open schools and you shouldn't fully close schools right now. But I would say directly the infection rate number is what we're keeping our greatest eye on right now.
Wanda, how about you? Do you find yourself hopping from idea to idea? Is the data a little overwhelming, or have you found a rather consistent sort of way to look at this? Wanda, I'm sorry. It was for Wanda. If you, we got
Dr. Cook Robinson?
Yeah.
Did we lose her?
Oh, we lost her. I'm sorry. Then, Randy, let me let you go and weigh in on that question. Is the data we're being deluged with every day problematic for you, or is it helping you make your decisions?
It's problematic in regards to there's so much out there that people want to hang on to their own set of data that they think is impactful. But you know, from a big picture standpoint, the issue still is, you know, because in Wayne County we're a little bit higher with the percentage that Dr. Vitti said. We're right around that 5%. And so when you get close to that, again, the challenge for our school districts that I've talked to is, can we implement the recommendations from the roadmap to really make people feel like, you know, we've got the right things in place to have school. So if we're near 5 or a little bit below 5, you know, that number is going to fluctuate. It's hard to open and close school based on those factors. And so they're really focused on, you know, are we going to have a safe environment as we monitor that going? And that's been the big struggle that I've seen with some school districts. Everybody's different. When you look at a campus in Plymouth Canton with 6,000 students in 3 high schools right next to each other, and you go to another school district where maybe their high school has 450 students, they're 2 completely different issues. And so that's why you're seeing a little bit of variance from school districts, but it really is that issue. Can they implement those safety requirements that are outlined in the roadmap?
Yeah.
Yeah, Mike DeVoe, you know, very difficult right now to be a superintendent. So what are your thoughts on that? Just the back and forth, the different information and how
No. My job's easy compared to what parents have to do. Very easy.
Yeah.
Just let me set the table, right? We had a meeting last night where some teachers gave a presentation and talked about all the difficulties in having to go back in the classroom and their concerns. On the other side of the room, I had several special needs parents who were begging and talking about the need to have their students serviced.
Sure.
So my job's easy compared to the burden that they have, or a single parent mom trying to get education for a kid with remote learning or any kind of learning disabilities or ELL. So no, this job is easy here compared to what the parents are facing in the metropolitan area.
That's a great point, but we also can't leave out the teachers. And as Devin introduced earlier, we've got reps from our unions. Terrence Martin of the Detroit Federation of Teachers represents more than 2,000 teachers. And I'd like to start with you because you also heard what Dr. Vitti just said. Of course, you've been negotiating a new contract that is ostensibly supposed to include a COVID clause. How are those talks going right now? What should parents know today?
Well, first, thank you for having me a part of this conversation, a very important one. We are in talks not only about COVID return, but also about renewing our contract for our wages, working conditions, and benefits for the next upcoming year. And while the talks are going slow, we have been making some progress in many areas. One of the areas that obviously remains a challenge is how do we return, and how do we return safely?
Yeah.
How do we ensure teachers and other staff members that there's a reasonable assurance that the recommendations that have been made by the CDC and other entities are going to be upheld by the school district? How do we ensure that we make sure that there's proper PPE and there's cleaning products provided to teachers? And there's a reasonable expectation that social distancing is a possibility in many of our classrooms.
Yeah.
How do we make sure that there's proper ventilation in our buildings, where we know that the conditions of Detroit Public Schools community district buildings have made national news in the past with very poor ventilation and other issues relative to the physical plant. We know that there have been some improvements that have been made, but still we're nowhere near where our children and our community deserve to be relative to the conditions of our buildings. And so with all that, it remains with many of our staff members and our employees, that there's literally a fear of returning to face-to-face instruction in the fall.
We're hearing that, yeah. And I know Paula Herbart, who really represents the majority of the teachers in the entire state, more than 120,000 teachers. What are teachers telling you about these various back-to-school plans and how they'll affect actual learning and also student retention?
Thanks, Paula, for the question. I really appreciate being here. It varies from area to area, but the most important thing that we're hearing from our members is being a part of the development of the plans that each school system is putting forth. We represent over 1,100 locals in 550 school districts across the state and all 83 counties of Michigan. And so what might be true in Ontonagon may not be true in Southfield. What may be true in Benton Harbor may not be true in the Saginaw area or in Reese in the Thumb. So we really believe in our lowercase d democratic process. We've empowered our local leaders to make sure that they're a part of the process. Under para, working conditions, health and safety are required subjects of bargaining. And so they have to be engaged in these conversations, not only to secure the safety and health of our members, but the students and the communities which they serve. And that's what they're really worried about, is if their voice isn't at the table, then those issues aren't being thought of in a more global sense in the community, and valuing the fact that teachers and education support professionals, we represent that group as well, whether you're an educator in the kitchen or on the buses or paraeducator or custodial maintenance, that you have families too. And that if you're going to work every day, or every other day, if it's a blended learning plan, that you're going home to families yourself. So that's why it's critical that our members are a part of the decision-making promise, part of the decision-making scenarios, and that they are problem solvers in this work to ensure that students get the best education that they can, understanding the circumstances that are real in their communities.
So, Paula, just a quick follow-up on that, and I'd also like Terrence to weigh in as well, and that is whether or not you feel like you really have been at that table in these discussions enough so that your teachers feel safe enough returning back to school.
Well, I can tell you that the strongest plans that we have right now, and those that have already been turned in, are ones that by and large have been worked on with the staff and our members across the state.
Okay.
Where they're having problems, where they're not allowing educators to be a part of the decision-making process, that's where the holdup is. We've had a couple of districts that have said, here is the plan, what do you think? That's not bargaining. And so in those instances where we're not being allowed a voice at the table, we're doing the things that we're legally allowed to do to ensure that our voice is part of the process.
And Terrence, what would you say?
Well, we haven't been part of the process. To Paula's point, there was a plan developed by the district.
Paula
it was issued.
Paula
Herbart.
Yeah, two Paulas in a row.
It was issued and put out to the general public without the union's input, without teachers' input, and we found that very disturbing for our membership. And look, we have folks who are certainly ready to teach, want to go back to school and teach, but don't feel that it's safe to do so face-to-face. And so we certainly encourage the school district to continue the talks that we've had just recently, and really we've been been talking more recently about what that looks like in terms of returning to school. But initially, those plans certainly were not including teachers in the conversation.
Well, quite serendipitously, in our Brady Bunch graphic that we've got going right there, Terrence, right above you is the superintendent of Detroit Schools. Nikolai, talk a little bit about the concerns that you've just heard there, both him feeling like they've been left out a lot of the conversation, but also his earlier point about worried about the health factor of facilities, air circulation, that sort of thing. Dr. Vitti, go ahead.
Yeah, sure. So there's been plenty of plans that have been issued from the CDC, the AFT, Governor's Return to Learn Task Force, that outlines the safety strategies that have to be implemented if there is face-to-face. And again, if the governor, state, local health department states that it's unsafe to do face-to-face, then we won't. But what we can say as a district is that unlike other school districts, we do have the resources to implement the COVID safety strategies. We received $85 million as DPSCD to implement the COVID-related strategies of temperature check machines, more nurses for each building, a symptoms check process, deeper cleaning of buses and classrooms, PPE for all students. So you can't read our plan and it not mirror all the best, all the safety requirements for COVID. So in relation to engagement, when we released our draft plan, we had 1,200 people participate in virtual meetings about that plan, where feedback could be given regarding what worked, what didn't, what needs to change. And there were quite a few changes made before that final draft plan was given to the board for approval. After the board approved that plan, over 9 community meetings over these last 2 weeks, we've engaged 20,000 internal and external stakeholders. I'll repeat that, 20,000. Yeah. So does it mean that everyone agrees with the plan? No. But it's really hard to take a plan as complex as this one, where you have multiple people wanting different things. Oh, you want parents that, right now we've engaged almost 70% of our parents, and 20 to 30% want face-to-face instruction. Are we really going to ignore the voice of 15, 20,000 parents about face-to-face if the state says it's safe?
Hey, Dr. Vitti, can I jump in there? Dr. Vitti, let me just jump in there just for a quick minute.
Paul, real quick, there is been engagement. The question is, how do you move forward with trying to keep everyone's interests in mind? And it's nearly impossible to do that. Sometimes you just have to make hard decisions based on what you think is in the best interest of students and continue to communicate and problem solve, just like Paula said. Are we problem solving and are we owning the process and the implementation of it, or are we just simply saying we don't want to do it?
So we want to move on quickly, but I do want to also address the fact that the question on the table is that the person right below you in the Brady Bunch box is Terrence Martin, president of DFT, and his thought is that teachers have not been involved. So you talk about the 1,200 people, you talk about the 20,000 stakeholders, but I wanted you to address, and I think that's what Devin's question was, to address what Terrence Martin was saying, that he feels that teachers in your district have not been at the table enough to have enough input so that they feel safe going back into the classroom.
I can guarantee you that when I say 1,200 people participated in the draft plan, many of those were teachers. It also included every single union leader. When we engage the community about the final plan, of the 20,000, I guarantee you that teachers were part of that plan. We will be consistent with the collective bargaining process. If anything has to be collectively bargained, it will be collectively bargained. But in the end, it is difficult to create a reopening plan with every single entity agreeing on that plan. But we are committed to negotiating everything that needs to be collectively bargained. We have been doing that and will continue to do that. And I believe whether we're talking about DFT, teachers in general, we're going to arrive September 8th in a place that meets students and parents where they need to be. DFT has done that consistently. Teachers have done it, and we're going to get it done by September 8th.
I'd like to move to another topic, and I'm going to admit to you, I was hoping that what happened to us earlier would happen, that somebody would drop out of the call, because I want us to talk a little bit about our digital and connection issues and the digital divide and how we keep people from who are already maybe at the margins from falling further behind. And Wanda Cook Robinson, you dropped off the call and you're back with us now. And I'm also going to want to let Representative Hornberger weigh in on this issue. But are we doing enough? After we had 3 months of trying to figure out people learning from home, we got a lot of folks in both rural and urban areas. Their only internet connection may be coming in over their phone. Are we doing enough to prepare for this new landscape where we have to have virtual learning for who knows how long?
Yeah, Dr. Cook Robinson.
Yep.
Oh, I wasn't sure. Yes, in fact, we are continuing to work on this issue. We were supported by the Skillman Foundation and also United Way in helping us to provide connectivities in those difficult areas in Oakland County. We still have those needs. Am I still with you?
You are, yes,
a lot
indeed.
Of trouble.
No, you're in. Yes, indeed.
At home tonight. Everybody in my neighborhood must be using it. But we, as I said, we involved the Skillman Foundation and United Way in helping us to provide that connectivity. And we are still working on it because we still have areas in Oakland County, particularly in Hazel Park and Oak Park, where there's not connectivity in the homes. And that is a problem.
Yep.
And we're working on that. We're trying to find stations around the community where parents can go and get connected. The first problem we had was devices, but we think we have just about solved that, again, with the help of the philanthropic community. But the connectivity is still a bit of an issue for us.
Well, certainly, Detroit had a great advantage this year in that they had that wonderful partnership, that $23 million. But Dr. Cook Robinson, I also wanted to stay with you because, for instance, I was talking to the superintendent of the Southfield School District, which is Dr. Green, as you know, and she was saying in Southfield, which is, you would think, well, Southfield, but they have a very, very high free and reduced lunch rate, as well as she's saying that as many as 40% of her students, for instance, don't have devices of their own. So it's one thing to have connectivity in a house. It's another thing when you have kids in school, in class, and they don't have devices of their own. And so how close are you to bridging that for communities like Southfield, Oak Park, any of your Oakland County communities?
Yeah, we are still working on that issue. I think we have done a good job in reducing the percentage, but we have not exonerated it. We do not have every child with their own device. And you are absolutely right. It's really difficult in a virtual environment to have a household of 3 children and each of them having to share.
Yep.
So we are working on that. We are still working to get grants. United Way is still working with us on finding possible funders to help us to purchase those devices. But we have made great strides in that area, and that we have fewer and fewer. And working closely with Dr. Green in Southfield, Jamie Hitchcock in Oak Park, and Dr. Krupi in Hazel Park.
Critical. Let me bring in now Representative Pam Hornberger, who is the chair of the House Education Committee. I want you to weigh in on the digital issue in a moment. But Representative, if we could, let's start with, I'm curious about what you're hearing. Are you hearing mostly from teachers, from parents, from superintendents? Where is the lion's share of, I don't want to call it complaining, but concern coming from in Lansing?
Well, early on when this all started, I started Zooming with ISDs around the state and talking to superintendents. So I've heard from a lot of superintendents. I'm hearing from, as a former teacher and a former school board member, I'm hearing from a lot of teachers that I know, and then a lot of teachers just in my area and throughout the state that are reaching out, and parents. Yeah, definitely. My daughter just graduated from high school, so she, she got to be the recipient of, no in-person graduation, which, we rolled with. But so I'm hearing it across the board, and it's there are a lot of different issues that I know all of us are dealing with. So, and connectivity being one of them. I think early on talking to superintendents, not only was that an issue for students, But even if they were able to get the devices into students' hands, it was, is there someone at home to support them if they're not able to get online on their own? What is there an issue with, 3 students and a parent trying to work from home with connectivity and broadband? So, another issue that's going to come into play. But interestingly enough, I had superintendents reaching out and saying, we have teachers that are telling us that they don't have connectivity at home, that they don't have internet, or they don't have devices.
Yeah.
So, one of the things early on that we started when we started talking with the governor's office was, in order to not have that issue, if districts were going virtual, it was a request to have teachers, report to their buildings and teach virtually from their classrooms, because that would solve a huge problem for school districts as far as connectivity and teachers having the devices that they need to teach. And then as far as, if there's a tech issue, there are tech people right there. If a computer dies that a teacher is working with, students, they can quickly move to another area. And then just, our teachers are going to need to quickly become experts in online teaching. And as a former teacher, that's a difficult thing to learn.
Oh, there's
they
no
did their
doubt.
best in the spring, but if they are in the building and in the classroom teaching virtually, then there's also time to do, cohort meetings between if 3rd grade teachers need to meet or science teachers need to meet. And there's also, that professional development piece that can come in that can help them, hopefully become better online teachers, because it's not going to be an easy task.
It's a different skill set. But Pam, I also, though, want, and I don't want to call out any names here. I don't know if any of our superintendents want to voice this to you themselves. But in our conversations, and I'm not at liberty to use names because these were background conversations with the newsroom with a number of superintendents across Southeast Michigan, there was ardent frustration from them that they have not gotten better direction from Lansing on a plan, and that there needed to be more state coordination. I don't know if a superintendent, and at this point I probably have to ask you to raise your hand so I can see, so we're not talking over each other. If anybody wants to voice some of their frustration with what they've got, whether it's coming out of the Capitol or the governor, or the governor's mansion, but there is this palpable sense of frustration that there hasn't been more of a coordinated plan focus as we move now so close to the start of the school year.
Oh, I'll agree with you. It's frustrating for me to have to negotiate through this process. This is something that should have been done weeks ago. We knew what we were facing. All of us know when school starts and what goes into the beginning of the school year. I did it for 23 years, and I did it as a school board member for 6 years. This isn't something that blindsided us. This should have been put in place a long time ago.
So if I can ask, why hasn't it? If I can ask, let me jump in there. So why hasn't anything been done? Because we're at the 11th hour for school. Well, these superintendents are putting together budgets, and they don't have guidance on what those budgets are going to look like. They don't know how much of a budget cut there's going to be. They're all buying PPE. We know what time and what days school starts. So I'm curious to know. Everybody knows you're an educator.
Right.
Aaron Miller is an educator. You knew school was coming, and so what's taken so long?
Well, you got to negotiate with the governor's office if you want to get anything done.
Is this just the governor? I mean, you all have to negotiate together, and the plan still has to be in place. You still have to have money.
So there were two plans that were put out. The one that our caucus put out, and then the one that came out from the governor's office. And when you sat and side by side read through them, they agreed about 85-90% of the things in there we were in agreement.
Okay.
And now it's coming down to the basic. It's not the day-to-day issues that we're negotiating. It's the count days that are we going to do 180 and 198 hours or 1,098 hours? Are we going to? How are we going to do count days? Is it going to be a hold harmless for last year's count, or is there going to be a blend? And quite honestly, that is what the issues are. That's what takes most time.
Well, as long as I have you on the line, just very quickly, and different house, but you're all under the same roof. And that is, we've been talking about the Senate meeting this Saturday to talk about whether or not they're going to mandate schools have in-person learning. The majority of schools are going remotely. You've got to be a fly on the wall. What are you hearing about that?
I don't think you're going to have to worry about mandates.
Okay, so
how about if I leave it at that?
Okay, so they're meeting Saturday, and you're saying don't worry about it.
No. And as far as, myself and the caucus that I've been working with, we want to give districts as much options. As Paula said earlier, what happens in Reese in the Thumb is way different than what's happening in Southfield. And we even see those differences across ISDs, so we want locals to have the ability to work with their health departments in order to come up with what's best for their district in their area. No one wants to mandate anything.
Paul, I believe you had your hand up there. You want
No,
to
that was Terrence. Terrence Martin.
Oh, Terrence.
I
I'm sorry.
did.
Terrence.
Oh, and
both
Paula
of you.
too.
Both of
Okay.
you. All right. Paula, you first.
So the biggest thing when you're talking about funding is that Michigan has been woefully underfunded in its public education for the last 25 years. We're 50th in the country in increased funding amounts over the last 25 years. And we know that the situation with COVID adds approximately $400 extra per pupil to educate while we move into a COVID-19 school year. So we're already underfunded. Now we're behind approximately $400 per pupil, and we want to be nickel and diming these school systems. Thankfully, the state legislature and the governor have worked out to fill some of those funding gaps. We're about $1.4 billion in the hole of the school aid fund because of economic turndown due to COVID-19. We know that. We're filling it up. We have to get the federal government to pass the HEROES Act. Simple. We have to get our Republican legislators, our Republican members to contact Republicans outside of our state, because Senator Stabenow and Senator Peters are incredible advocates for the HEROES Act. We have to get the Senate in the United States Senate to act on our HEROES Act funding and ensure that we get it. They're stalled right now in monies, but our students can't wait. We don't have one child to spare, and we don't have one school district to spare when it comes to funding at the level that they deserve and that it takes to actually educate our children here in Michigan.
Okay, and then Terrence Martin.
And if we're going to talk about funding, we also need to talk about there was some cost savings that was realized by every district. And I talked about this early on, and then everyone stopped talking about it. So when we're not teaching for however many months in buildings, there's a cost savings that's realized through subbing, but the amount that we pay for subs every week. I know in my local district, it's $6,000 a week is their average. The amount that they average out for their copy costs when they're budgeting. And so when you add all those little things up, including, I believe every district received a rebate from their dental insurance, because dental insurance, the dentist offices were closed, at least every district that I've talked to has. There was a significant cost savings in every district. On top of the fact that everyone was fully funded for last year, what was budgeted, they got. And there were COVID dollars that came in based on a poverty level. So a lot of districts, every district got money. And there was an additional $175 given to districts for this current, last school year. As we move forward into the 2021 budget, we have small businesses closing every day. Until we can get a handle on our economy and until we see what happens in the CREC conference on August 24th, we're not going to know a whole heck of a lot about what happens with the school budget.
Okay,
our school budgets depend on our economy to be thriving.
All right, we do want to get to our viewer questions, but I know Terrence Martin had his hand up. So let's get to Terrence Martin, and then we want to get to some viewer questions.
Just really quickly about funding, and Paula sort of touched on this before. The state of Michigan wasn't doing so well prior to COVID relative to properly funding its schools, and particularly schools in urban areas such as Detroit, where we have the largest concentration of students with specialized needs, and those go grossly underfunded. But I also want to clear up something that was said a little bit earlier. As we talk about such a tough issue, and such a critical issue, particularly for Black and Brown children in the city of Detroit, we've got to lead with facts. And the fact of the matter is, the Detroit Federation of Teachers and its employees were not a part of the district's draft plan, not at all. We certainly wish we would have been, but we weren't. And so really, we've got to be very careful and got to be truthful when we talk about and share with the community, because they deserve to know the truth. and we were not at the table in the beginning.
Let me quickly let a couple of more of the other superintendents weigh in on the funding matter. Randy Leap, if I was a superintendent, I would be waking up bolt upright in bed every 2 hours, freaking out over worries about how schools were going to be funded and whether it was going to be equitable given the new realities that we have here. Is that a worry of yours right now, and how do we address it?
Yeah, you know, we're still looking at a $700 per student potential shortfall for the next upcoming school year if nothing changes. And so that's what school districts are facing. If you're looking at a 10,000 student school district, that's a $7 million budget problem. I would also highlight last year that school districts were required to maintain all of their staff through the end of the year. And so the ability to actually save money last year was not there for school districts.
Right.
Would have been tough anyways, because many of the people, transportation drivers, food service workers, they were actually working to deliver meals and doing a variety of other sort of emergency types of activities in their school district. And so it wasn't that they were sitting around, but there really wasn't funds to be saved for last year. There are some additional dollars that came through CARES. They are limited in regards to how they can be spent.
Yeah.
And so school districts, and again, it's that issue of we just need our answers. We need answers so we can plan. School districts, as we sit here today, are still looking at about a $700 per student shortfall going into the next year as they're putting all of these plans in place. Representative Hornberger was correct. They're going to receive about $175 in additional funding for the COVID costs. But Paula Hebert was right also that we've seen estimates that are at least $400. We've seen actually a little bit higher than that per student in regards to the cost to do the PPE and the safety requirements. Representative Hornberg's right. If we were off school all year without a question and did not have students in place, potentially there would be some savings there if we were allowed to do that. We're not allowed to do that under the roadmap that we have in front of us. Yeah. But I would just highlight that school districts aren't looking at that. They're assuming at some point in time kids are going to be in, and they may be in and out. And so that's a remarkably difficult thing to plan for. That's why they need some stability in their budgets.
Michael DeVault, when I hear parents talk about maybe switching school districts because they think somebody else might be better with their online approach, and yet halfway through the semester they have to think about maybe switching back and going in person, and now they've hitched their wagon to a district or a school that's too far away. I'm at a loss as to figure out how you fund that equitably.
There's no question. I mean, that's why we've asked the legislature to look at funding on the, I think the February 2020 count, because during this situation, I mean, that's one management solution to this that we have recommended. And I know that's under consideration right now. But I'd also like to kind of double back, because I know the time's getting short. Whether we're in remote or face-to-face or hybrid, my concern is, and I want to make certain that the public gets a chance to hear this, is to take care of the students that are having difficulty with learning on a remote model.
Yeah.
Also the ELL students and the special needs students. We as superintendents and school boards need to make modifications so there can be some face-to-face time, and either in small groups, because that's what I was hearing. That's what I hear from parents. That's the calls I get every day from parents. And I know our teachers support that type of instruction, but that has to happen. Otherwise, those students are going to be way more disadvantaged than they are already right now. So, I mean, I think we can do everything else very, very well and handle those problems. But that's my major concern of that population. And I'd be remiss if I didn't at least let your viewers hear that request that all leaders look at that compassionately, and teachers unions, management get together to solve that, not solve that problem, but at least address it.
We can hear that loud.
You know, we're talking about some very important things right now. We're really doing a deep dive here. So we're probably, I can say, definitely going to run over just a little bit. Bear with us. Now, at Local 4, we're very fortunate to have Dr. Frank McGeorge, and he's an emergency room doctor at Henry Ford Hospital, leading our medical coverage of this pandemic. He has patience, and today he's been very patient, as a matter of fact. He's helped us really understand and navigate the science behind the spread of this virus. So, of course, we have him as part of this conversation tonight as well. And Dr. McGee, two really important issues stand side by side in the same room. Now, we know face-to-face learning is optimal for a variety of reasons, but that doesn't necessarily mean it is safe to return. we have a specific question about this. So I do want to go to a viewer question first. And she says, this is Carolyn from Ann Arbor, and she asks if the safety and well-being of children is our primary concern, and the percentage of COVID-19 deaths of children between the ages of 5 and 14 is 0.13, and masks will be worn by teachers and students. Why would teachers feel they can't return safely, especially when CDC guidelines report no reason why children and teachers can't return safely to school? So, Dr. McGee, what is the science behind deciding if it is safe for your particular child to return to the classroom in person?
Well, all right. Thanks, Paula. First, I want to address that number. There's a lot of different numbers being thrown around, and I'm going to have you roll a story in a minute about the numbers. But I think this highlights, or that question highlights, a couple of important points. First of all, we are concerned about student safety, but I think it's also relevant to talk about teacher safety and safety of ancillary staff in the buildings. There's a much bigger picture here that we have to think about. But going back to sort of the core issue of students and student safety, let me just start out by saying, my mom always reminded me to never argue politics or religion. And oddly, I am finding myself saying the same thing now about the science of COVID-19. The issue is, while there are objective numbers in the data, everyone has on what those numbers mean. Sometimes even the numbers are in dispute, and people quote different numbers that are not necessarily compatible with, I guess, what I would consider the most reliable statistics, whether they're from the CDC, the World Health Organization, or really even the state. So this is a charged issue, especially when it comes to the emotion of school reopening. I want to just have you run the package that I had earlier about some of the numbers from 2 new reports.
A new study published in the Archives of Disease in Children found that between January and May of this year, children, defined as being under 16, represented only 1.1% of SARS-CoV-2 positive cases in Great Britain. In the same time frame, there were 8 pediatric deaths, representing a case fatality rate of 0.3%. Additionally, using historic mortality data, the authors were able to show that there were no additional deaths that might represent undetected cases of COVID-19. In the end, the authors concluded that, quote, "Our findings provide further evidence against the role of children in infection and transmission of SARS-CoV-2. The data from that study should be contrasted with a recent report from the American Academy of Pediatrics and Children's Hospital Association. Using data within the United States, they found, as of August 6th, pediatric cases represented 9.1% of all SARS-CoV-2 cases in the U.S. Back in May, when the UK study ended, it was only about 3%. The reason behind the rise in the U.S. isn't proven, but experts have noted 2 factors: increased testing in children, even if they're minimally symptomatic or asymptomatic, and generally increased spread in the community in both adults and children in recent months. Even with increased pediatric cases, according to the data, children represented between 0 and 0.4% of all COVID-19 deaths in individual states, with 19 states reporting 0 child deaths. That's compatible with the CDC's data showing that compared to 18 to 29-year-olds, children less than 18 have a 9 to 16 times lower risk of death.
So, I think it's really important to understand those numbers are what we know right now, and it's highly likely that we're going to learn more to refine our opinion over time, especially as schools reopen. But the bottom line is, these facts are: children do get infected, although they do not get infected as often as people over 18 and not with as severe consequences. The real question ultimately, though, is how much risk is reasonable? And I want to put a little something in perspective here, because I really appreciate what all the superintendents are talking about. But I think a lot of this is, from a parent standpoint, personal risk assessment for yourself, your family, and really your child. So the decision about returning to the classroom, in my opinion, for in-person learning is highly individualized, that every parent needs to think about based on a number of different factors. I'm going to lay some of my thoughts out. First off, What is your household risk tolerance? Is there someone at home, for example, who is a concern because of their medical history? If that is the case, then maybe your child being back in a larger exposure environment may not be as useful or as good or safe. And I would argue actually the same holds for teachers. For teachers, if you have significant medical problems, if your spouse or a family member has significant medical problems, that is a significant mitigating factor in your risk equation. So next, what are the needs of your child? And, some of this was touched on. Will the child learn better in person? I think universally everybody understands in-person learning is better, but everybody knows their child as well. And they know that some children will not thrive in a screen.
That's what's wrong with.
Have we lost Frank? I believe we've lost Dr. McGeorge. We will try to get him back because these were terribly important thoughts as we try and take folks, each individual. That's what we keep saying. No matter what districts decide, no matter what teachers or superintendents decide, or even what Lansing decides, parents each have to make a decision for what's best for their own family. Dr. Vitti, before we move on, I know you had your hand up as we were talking about the funding issue. You want to weigh in on that real quick?
Yeah, I mean, not specifically on funding, but I think it speaks to what Frank was actually trying to say, which is we can't really talk about parents making a decision if we're not allowing for both face-to-face and online options.
No.
Since we're not receiving any guidance at the federal level and the state guidance has been mixed as far as consistency, if we are able to offer face-to-face learning, then we're going to have to problem solve regarding what that looks like. So, no one wants to see the superintendent and the union leader seemingly fighting on TV. That's not what kids want to see. Kids and parents want people to work together to figure it out. When the draft plan was released in June, DFT and district administrators meet almost 3 times a day. So if there isn't time to talk, I don't know when there isn't. And so demands that were requested for the most part focused on not offering face-to-face learning until there's an immunization. We cannot, and I don't think DFT wants to do it. I don't think our teachers want to do it. We're not going to abandon 10 to 15,000 parents that need and want face-to-face instruction.
Well, you make it
to problem solve and own the challenges of COVID in order to do that. And I'm optimistic that it'll happen. And we'll continue to negotiate what needs to be negotiated. Yeah. I think it's important for our Detroit parents and teachers to hear that.
And you make an important point about if those options aren't available to parents, then their decision ends up being one to perhaps leave a district. Dr. McGeorge, I believe we've got our connection again secured with you. You were in the middle of a really important breakdown about families making their decision.
Yeah, and how to make those decisions.
Oh.
We still don't have Dr. McKay.
Okay, I'm afraid we're still. Okay, let's tell you what. Let's move on to the next group that we want to bring into being a part of this conversation. How do teachers feel about going back to school this fall? We have 3 teachers with us tonight. Happy to introduce to you Mark Sobolewski, a middle school teacher from Ann Arbor Public Schools. Lena Larson is an elementary school math teacher from Detroit Public Schools, a community school district. We should mention that she has also been teaching in-person summer school. And Christopher Capuano is with us, who is a civics and history teacher from the Novi School District.
Teachers, so it's not just school districts and the state trying to figure out how we're going to pay for all of this. Families are obviously burdened in many ways by this pandemic. Parents in every district are faced with how to keep working while making sure their children are safe and getting an education. And so teachers, what I want to know from you basically is, how are you helping your parents navigate this? We know you've been talking to students. You've had them in person for in-person learning as well as remotely. How are you helping your parents navigate this?
Mark, let's start with you.
Well, trying to answer as many questions as possible, with limited information still. Oftentimes I think that parents, the first people they feel comfortable reaching out to are the people they're in most contact with, which is us, the teachers. Unfortunately, sometimes in these types of situations, the information is slow to get to us. So just trying to be as supportive as possible, trying to reassure them that whatever that we provide in the fall is going to be meaningful and rigorous and isn't going to be busy work.
Busy, yeah. Sorry, you kind of dropped out there for just a
Right at
moment.
the end, yeah.
Yeah.
Let me bring Elena into this. Elena, we watched a lot more drama than we usually see around summer school, obviously, this summer. You were a part of that as you were teaching summer school. What are your thoughts now heading into the fall?
Well, to try to recap the original question, to bring our parents in,
Yeah.
my building principal was very, very forward thinking about how we would start involving our next year's classes in any kinds of decisions that were made. So even though we've been off work up until the summer school time, we were dojoing, calling, texting, trying to get our parents to take the technology survey to get their devices, working with the staff up at Mumford, which is where the devices from my school were passed out, to let our parents come up on off days, the days they could get there, doing the survey with parents over the phone, helping parents do the survey for return to school now that they have the devices, and getting people acclimated just to the teams and how to do the things with the children. A big part of what we did in summer school too was the children that were in there were not always able to participate in the distance learning. So we also worked on getting them to learn teams, but just trying to be there and listen to what the parents are saying, because it wasn't so much the students we were able to engage with on a daily basis that I was concerned about. We were doing our, calling families and making sure everything was all right, trying to call people once a week, check in, find out how things were.
Yeah.
And just hearing what the parents were saying about what they needed and what their frustrations were and how, things were not going ideally for them. And I know that Dr. Vitti and Connected Futures has worked really hard to get us technology, but I'm still not sure we're going to be able to reach a significant amount more of students if they don't have someone in the home to help them.
That's huge, and that really brings us to our next viewer question, because Sina in Redford asks this question, and we know many parents are grappling with this for themselves. And this is what she says. She says, who is going to teach my son all day while my husband and I work? We're both essential workers. I'm a nurse, and he is in retail. Our child care provider is my 74-year-old mother who doesn't have the internet or the patience or the know-how to be my son's third grade teacher. And so how would you answer that question?
Let's go to Christopher Capuano about that one.
Are you specifically addressing me, or do you just want a teacher?
Oh, yeah, we wanted to hear from the teachers, but we haven't heard from Christopher yet.
Okay.
I would have to say that that's a great question. I mean, that is one of the things that a lot of people are grappling with. We're trying as much as we can to help and support people who are in difficult situations, but at the same time, we're limited for what we can provide. We, as teachers, we want to get out there and we want to teach. Technology is a tool to do that, but it's also something that we're learning to do as we move through it. And it is a very difficult situation, especially when you have parents that have responsibilities that don't allow them to help their children at the time that they need it.
All three of our teachers, I want to ask you all, where do you want to be? Where do you feel, and I know you all want to be in the classroom, but right now with all that you know, where do you feel is best for you to be moving into the new school year? Mark, you first.
Home. Absolutely. I think we should be starting virtually. And that pains me to say. I didn't become a teacher to teach virtually. But as a social studies teacher, I just keep thinking, is it really up to the public to determine when we go back to school? When I stop seeing news stories about large events happening in Michigan and 4th of July parties and all of these all of the pushback to all of the medical advice we're getting, I think it's the public's responsibility to put us back in our classrooms.
We are in the middle of quite a social studies project. That's no doubt about that. Elena, where do you think you should be in the new school year?
I'm so afraid to go back, but my heart is with the parents, and the parents that don't have the choice to work inside the home, or the parents that don't have the choice or the means or the access to get a pod or private tutoring. So I don't know if it's because I worked within the Archdiocese for a significant amount of my teaching career, but this is my calling. And I feel like it's my duty to go back to work. At the same time, I fully support any teacher, such as Mark. I'm not sure how Christopher feels, who feels it's not safe to go back to the classroom. I wish more districts could give the option that our district is large enough to give. I'm still very concerned because I'm not hearing voices of teachers in the special ed and all the various specials. We're just 3 voices from so many teachers that all have fears, and children that may not be in the same district as them, or children that may not have the supervision they need. Well, the child is home for online schooling because that district is not online, but the parent teacher still must either teach face-to-face or teach digitally from a building. So there's just so many considerations, but I respect everyone's decision. I know that I'm not even gonna lie, I've been told some things, but I'm okay with it. I've never waited for anyone to ask me what my opinion is, and I've never apologized for what I've said. So I'm with the parents.
Well, let me let Christopher weigh in then. How are you feeling? Where do you want to be?
As a teacher, I want to be in the classroom. I got into it because of the students, and that's why we all want to be there and what we all want to do. However, depending on when you ask me and what I've just previously read, it sways my opinion because we're constantly inundated with so much information. One day it sounds great, and the next I'm reading stuff where in Georgia they're quarantining 1,200 students. It's a difficult situation, and we want to do what we can for the students, but at the same time we want to make sure they're safe, and we're safe because, as stated, we have ancillary people around us that have issues. So it's not a cut and dry situation where you can say, I want this.
Yeah.
As teachers, we tend to roll with what happens. I just want to be safe.
Yeah.
Yeah, good. Well, good segue to get back to Dr. McGee, because I think we've worked out all of your bugs. So, Dr.
You got me?
Yeah, I think so.
You hear me?
Yeah, but this is so important, and we do want to get to some more viewer questions. So, stay with us if you would. We know we're running a little bit long, but this is a big conversation. This is a big topic. But you were in the middle of explaining how parents can decide
And
for
teachers.
themselves and teachers
Yeah.
for themselves. Thank you. When it is safe and how they can determine if it is safe to do face-to-face or in person.
Yes. So, again, and I apologize for missing part of the conversation if I'm repeating some things. But, first off, you have to ask what your household risk tolerance is. Basically, what do you have going on at home that would make it safe or unsafe for you to return to in-person learning, whether that's as a student, parent, or or ancillary staff in a school. What are the needs of your child? Different children learn differently in different environments. Special services are available that are best done in person, especially special needs classes. Perhaps that's where a child gets nutrition. In some cases, it's a real world consideration. Parents simply need to know that their child will be cared for because they cannot care for them because they are otherwise working. But then even bigger picture, you have to ask whether the school is ready. What are the policies and the procedures for risk mitigation, whether that's masks, cleaning, distancing, symptom screening, response to positive cases? Are you as the parent or the teacher comfortable with what the school is doing? And that speaks to what I think a lot of the superintendents have addressed. But finally, there is the really big picture. What do the numbers look like in your school, in your city, in the county, and in the state? Because those not only change your personal risk calculus, dictate a community public health response and change everything. I mean, if all of a sudden our case positivity counts go above 5 or 10%, 5% really, that would suggest widespread community transmission. And at that point, it's no one's decision. It's the governor's decision whether or not we go back to a stay-at-home order. I think everyone needs to acknowledge here that the risk is never going to be zero. And everyone's tolerance for risk is going to be a little bit different. And I think because every family has different needs and different risk tolerance, schools should be and are doing whatever they can to accommodate both in-person and remote options if possible, knowing that in-person education is really the best choice and I think the most ideal goal.
Doc, I want to quickly follow up. You mentioned the cases. You and I and everybody at Local 4 promised ourselves very early on we were never going to get either too rattled or too delighted by any single day's data. However, today's new reports on cases took us back over 1,000 cases. We jumped quite a bit over the last 24 hours. I know we wouldn't want, I don't want to make, nobody's going to be expected to make decisions on one set of 24-hour cases, but what are your concerns as you looked at the newest report today?
Well, it's not just the newest report from today, actually. If you look at the curve, so the state of Michigan logs new cases by the date of onset of symptoms. So, in fact, we report on the news a new number of cases every day, but you actually have to look at the MyStart graphs to figure out what date those new cases are actually placed on, because they're not distributed only on the day that we report them. They're actually distributed for, in some cases, a week or two before, because that might have been when the symptom onset was. The point being, I've been watching the symptom onset graph over the last month, and it has been steadily building. And so, today's high number is just going to add to those last several counts. And ultimately, what we need to focus on is not only the daily case count, but really whether or not there's evidence of ongoing community transmission. And honestly, schools are a huge priority, but ultimately this is going to have bigger ripple effects, whether it's, casinos, restaurants, you name the business.
Sure.
We're going to have to reel things back if those numbers begin to go back up. And frankly, I think, the making the case that taking proper precautions, whether it's distancing, mask use, whatever, would help everything is absolutely accurate. If we as a society do not do our part individually and as a society to reduce transmission, we are going to continue on a very Frankly, if you look at the curve of daily new cases and the general trend, it's actually going upward and there's a slight downward trajectory. That downward trajectory should not fool anyone, because if there are new cases that occur over here and they get redistributed to that downward area, all of a sudden in a couple of days, that downward area is going to go right back up. Yeah. So this is a much bigger thing than just looking at daily case counts. And I'm sure that there are epidemiologists in Lansing. I know, the director of the medical director of the Michigan Department of Health and Human Services, she's looking at these numbers on a daily basis, and everybody is trying to make a decision about when we need to pull the trigger on rolling things back if it's necessary. This is going to be a decision not only at a state level, but at a regional level. And that's why I encourage every parent to stay active and pay attention to the numbers again.
Yeah. All right, Doc, we're starting to struggle with your signal just a little bit.
Not only in their city, not only in their county, but in the whole, because that's really what matters, is the bigger picture and then drawing down into a smaller area. It might turn out that there's a hotspot in a specific county that might be accounting for a lot of cases, but there might be another area of the county that's just fine. And I want to make another point. There are some counties that are perhaps hot areas, and we always say that counties, people don't live at a county line. So if and I'm just arbitrarily going to say Macomb County, if numbers in Macomb County go up, that doesn't mean that those are only Macomb County people. Residents in Oakland County go to Macomb County, they share. But schools and children's generally really represent specific geographies. And that is a more controllable thing than patterns of traffic for employment and for recreation. So those are other considerations that I think need to go into the mix.
And that
Good, got to get to some other questions. We need to move that along.
That is why we have, so many questions, concerns, and emotions when it comes to return to school. So we decided to take a poll and talk to our WDIV insiders about how they're feeling. We polled 100 of them, and here's a look at the results. First question, do you think kids should return to in-person school classes this fall? 68% no. 32% said yes. Next, how long should virtual only exist? only the first semester wins with 34%. 30% want to wait until there's a working vaccine. 22% say the entire fall semester.
Yeah, now this one was really interesting because when asked how confident are you that school districts will make the right decision about returning to in-person classes and when to do so, take a look at this. 39% were unconfident, with 24% saying they were very unconfident. However, 28% say they are confident with the decisions. And hopefully by listening to our superintendents this evening, they might get a little more confident, understanding that there is a lot of thought going into this. This is what's keeping these educators up at night. So there is a lot of thought. The science is changing. It's a novel coronavirus. It's new. They're learning. And so they have to learn as well.
We keep forgetting the word novel as part of it. We're learning it every day. By the way,
novel, not the good novel.
Not the good kind. If you want to see the entire poll, and also we would suggest you become a WDIV insider, you can check that out on our homepage. So challenging time for parents now. Let's move to that part of this. Each family, as we've mentioned, making their own choices for their own different sets of reasons. We've got two parents with us now tonight. Keisha Barber has a 9th grader and a 7th grader. And Nikki Little has twin boys going into the 2nd grade. Thank you both so much for being with us tonight as we keep, it's a game of Tetris. We keep fitting all the boxes in. Keisha, I want to start with you because you're making a split choice. You're keeping your daughter at home to learn, but you're sending your son to school in person. Talk about the difference in the decisions that you've made and why they were right for you.
Well, it was a very, very hard decision, but my son is entering the 9th grade. He's changing schools. He's entering DPS schools. It's a brand new school system for him. And the school that we chose, it has a very, very small classroom size. I've been in contact with the dean and the principals, and they won't have any more than 7 students in the classroom. They have assured me. And if it becomes to be more, then they will, alert me and let me know as soon as possible. And I can change at any time and bring him home for remote learning. My daughter has been at the same school since kindergarten. She's very familiar with her teachers. She was very involved with the learning online when they ended school abruptly. So she's very comfortable with that. So my son, because he's going into a new environment, as concerned as I am, I'm going to send him into the building. He knows how to take all necessary precautions. And at any point, if he feels uncomfortable, then we'll change it and bring him home.
But it sounds to me, and I don't want to put words in your mouth, but it sounds to me that rather than saying you're confident and comfortable with the way this is going, you're sweating bullets over it.
Yeah, you can hear the
I
anguish.
am sweating. I don't think that either situation is easy for me. Having them home is going to be hard because I'm a single mom.
Yep.
And with my daughter being at home, neither situation is comfortable. Being at home or sending him in the building. I'm not comfortable with either decision, but I'm doing what I think is the best right now.
Wow, so tough decisions for these parents. So Nikki, you say that your sons will be learning virtually, but you're making plans so that they can work with other classmates, right? So is this one of these pods that we're hearing about?
Yes, it is. So we have decided to partner with 2 other families in our neighborhood who are approaching social distancing and safety guidelines the same way that our family is. So before we heard from our school district what the plan was, my husband and I, we've been working from home since mid-March. And so we were in the same situation as many other parents where we were teaching our kids at the end of last year and trying to figure out how to work from home and make it all work. So it was difficult and we made it through, but in waiting for our school district to make the decision, we were very heavily leaning toward virtual anyway. And our school district, we are in Berkeley, they did decide to go all virtual. So we immediately started talking with a few other families in the neighborhood and figuring out how could we find a few others that we trust who would agree to have open communication with us throughout this entire process, but we could still have that socialization and that small group learning that we know is so crucial for kids at a young age.
And Nikki, you're from Berkeley. Describe for me then what your experience was for those last 3 months of the school year with trying to do it at home. How'd it go?
It was a roller coaster. Some days went well, other days were very challenging. It's not ideal to work from home and try to teach our children, but we made it work and we took it one day at a time. And we're very fortunate that our teachers and our school, our principal and our superintendent, our district have been so openly communicative and very, very supportive. And they've been doing the best that they could do. And, like the superintendents here were saying, and Dr. Frank McGeorge was saying, it's a very personalized decision, and we have to weigh the different risks and assess what is best for each family. So what our family is doing may not work for other families, but this is what we've decided and we feel is best. So we're going to try it and do whatever we can to make it work.
Yeah, this is so representative of what's going on throughout our community with these two moms running the gamut, trying to figure out how to educate, how to best educate their children. Okay, so we've got another viewer question, and it focuses on what happens if school has COVID-19 cases. So a real concern for parents. Denise from South Lyon actually asks this, and she says, I've looked at my district's plan as well as a couple of neighboring district plans, and they all say if a COVID case is detected, they will follow local health department recommendations. But what are those scenarios? What will the health department recommend? My biggest concern, she continues, for going back in person is not the disease itself, but the inconsistency of jumping back and forth from in person to remote. And I need to know what situations will require a move to remote. Anytime a person in the school is diagnosed or just a specific class. So not sure how that would work in secondary, but that is a big question.
It's massive, and even though this one is specifically to Oakland County, all of you as superintendents are having to worry about that. I believe we've still got Randy with us, right? Randy Liepa is there from.
Yes.
What's going to happen if all of a sudden we get some cases in a school? What do you do?
Well, the health department in Wayne County has laid out a pretty clear plan in regards to what will happen. And if you look at what's happened down south already in some of the school districts that have opened up, it's a very similar process from the health departments across the country. And that is, first of all, you're going to quarantine. Secondly, you're going to contact trace, and then you're going to get quarantine those people. So that's why you see the numbers going up so quickly, and why there's anxiety among school districts that they're going to be in this rolling start and stop, because just a handful of cases in a school could lead you to several hundred students and staff that have to be quarantined, and all of a sudden the school has to shut down.
Yeah.
Well, Dr. Vitti does not have to guess at this, because this actually happened with in-person summer school. They had 3 cases, and that was a small percentage when you think about what was going on in Detroit, and it ran about the percentages in Detroit. So Dr. Vitti, the question to you is, what happened when you found out that those students did indeed test positive for COVID? Did you quarantine the entire classroom? And what happens to students who may have come in contact?
Yeah, so just to build off of what Randy had stated, I think it's important to note that the images and photos that we saw from places like Georgia regarding the opening were examples of reopening that were completely inappropriate, irresponsible, and did not follow a lot of the guidelines that were put out by the CDC. You can't open up a school with 100% of kids back without masks, traveling in hallways without staggered schedules.
Yep.
That is a recipe for mayhem. If any school district in Michigan is thinking about opening up schools like that, then it's contradictory to the best practice that we know regarding COVID safety. So in the summer, we did have to test because of a court order. The 3 students that tested positive were in 3 separate schools, and they tested after 2 weeks of summer school. So we did not see a spread of COVID due to face-to-face summer school, with them being in 3 separate areas. All 3 were asymptomatic and were not sick. But to answer your question directly, because we had small class sizes, which we would in the fall if we opened up face-to-face, you can identify what students were in close contact with each other and what teacher was involved, and then those individuals all go to a self-quarantine for 14 to 10 days. So it would be the students and any employees, and then we would shift to online learning. And then after that point, the parent would have a decision to come back to face-to-face or continue online.
You see, we've got a couple of students that have jumped in. We're going to get to them in just a second. I want to let the other 2 superintendents talk about this very important matter, though. First, that was an Oakland parent that sent that question in. So, Dr. Cook-Robinson, why don't you tell us what would happen in your situation?
Absolutely. What we have done, we are partnering with the Oakland County Health Department. We are going to assign a nurse to every single district in Oakland County, depending on the size and the demographics. and the facilities in the district, which is what we use to assign. Districts will have anywhere from 1 to 3 nurses. So we will have a nurse that will be monitoring the environment and will be actually monitoring this process. And it's exactly as Randy said, you know, we will follow those steps, but we will have a nurse monitoring that. In addition, we have set up a meeting with the executive deputy that the health department reports to. He and his staff will be on a phone call with all 28 local superintendents every single week. The one thing that we have to remember as superintendents make these difficult decisions, this is first and foremost a health crisis. Therefore, we need the health department helping to make these decisions and to monitor. For our superintendents, their number one issue is safety, the safety of staff and the safety of students. Yeah. There is no way we can provide a no risk environment, but we're trying to reduce that risk to the lowest possible risk that we have.
Yeah, it's interesting because generally it would be education first, but I think now it's safety and then education. Mike DeVault, do you have anything to add to that?
Well, I just add that our safety requirements are posted on our website at misd.net, and we've included them in every single plan that has been submitted to the that is due this Friday. Each superintendent's got them posted on the website, and it outlines specifically what would happen in each case, so mom or dad can look at it in advance and know what would happen, and every teacher would know what would happen. So I mean, I'm pretty confident that this situation, I mean, there's predictability under all those circumstances.
Yeah. Well, so we've heard a lot from superintendents now and teachers and parents. What do the students think? Very happy to have a group of them with us now. And joining us, Olivia Slazinski, an incoming freshman at Michigan State University. How's that for your freshman year off at the school you've been dreaming about for so long? Jackson Douglas is a sophomore at U of D Jesuit High. And Keziah Davis is a senior at Cass Tech High School. So I want to get to all of you with what your thoughts are as we get closer and closer to the school year. I really do feel for the college students who put so much of that thought into going away to school and
having that experience,
that whole experience of it. And this is kind of so dystopic. So Olivia, let me start with you. What are your thoughts?
Yeah, so I am still going to school in the fall, and they gave us a choice of like staying home or living on campus. And right now, all of my classes will be online, which is really difficult to hear just because I'm going into a completely new atmosphere and I am going to have a difficult time adjusting just because I'm going to have less relationships with my professors, with my classmates, which will be really hard, just like going into a completely new academic and like educational atmosphere. And now I'm like kind of thrown this curveball where everything will have to be virtual with new tools and new resources.
Not the way you dream it up, no doubt about it. Jackson, talk to me about your thoughts about going back to school at U of D Jesuit.
I'm actually going in as a freshman.
Oh, freshman, sorry. What a way to start high school.
You're right. But I'm going back in a hybrid mode as our school made it, which means I go in some days and I stay home some days, which means I get the safety of staying home and protected while also being able to get the in-class experience. And with my school, we have in the academy, you kind of get the high school experience, being able to exchange between classes like a high school would, and being able to have some of the same teachers that I would have had in the academy.
If it was completely up to you, is this how you would do it, a sort of a half and half hybrid system, or would you rather do it one way or the other?
I personally adapted to the remote style and feel like I still have some room to grow, but could definitely work with it. And just having that little bit of teacher interaction could help me a lot.
We haven't talked near as much about the kids for whom that was a better situation.
Yeah.
You know, kids
We've got one other student, though.
Yeah, well, that's true. Yes, I know. Go ahead. Let's
yeah, we want to hear from our other student. What are your thoughts? Yeah, Keziah.
Well, hello. So far, Cass, we haven't decided, or I haven't heard of if we're going to do it in person or virtual. I personally would just like virtual because it'll be easier and it's less risky for me. And once this first started happening back in March, I did adapt to the online learning and got used to that. And I feel like it'll be safer.
Yeah, and Devin, you're absolutely right, because listening to these students is so important, because that's who we're talking about. And so, I'm just curious to know, and if we have a little bit of time, then I do want to know if you have any questions for your superintendents. But I do want to get to one more viewer question, because this is a question we've received from several people. And Russell in Plymouth says, or rather asks, what about an educational gap? Now, this is something we hear about for college kids. Yeah, gap year. But now we're talking about schools. And so what Russell continues to say is, why would it work? Why wouldn't it? And Chris in Macomb Township says, can you just skip this year and return to school in fall of 2021? Why aren't the school districts giving the option of a gap year? And this one boggles the mind, because keep in mind, we're not just competing on a state level, we have to compete on a global level, and people in other countries are actually going back to school.
Olivia, did you think about taking a gap year?
Honestly, no, I didn't think of that, because personally for me, I can adjust to online and in-person learning, like regardless of my preference. But I didn't feel like a gap year would be for me, specifically to be like falling behind a year and having to give up my like a whole year of schooling. It would have been like uncomfortable for me to not be moving on with my college experience.
Sure. I don't want to, I guess I'll be the one who sounds like the grumpy old man who wants the kids off his lawn. Keziah, I'm curious, do you think your friends have a grasp of the seriousness of this virus? How seriously do you think that your friends generally think of this as a risk in their lives?
So with everything happening, I realized we are the most hard-headed generation. Not a lot of people take it serious. You know, I'll make sure we go in the store, I'm like, do you have your mask? Or I'll have extra masks in the car. So just knowing that my peers, it depends on, you know, how they actually look at it or what they've been through. I know a lot of people who didn't take it serious at first, but it affected their family, and they really opened their eyes to see that this is really a serious thing.
Jackson, same question for you.
My friends, we don't really like to talk about like the serious things that are happening in the world, but we still take it seriously. Like we still wear our masks when we're out in public.
Okay.
So we just like to just not think about it really.
Yeah, and that's really going to be a key for the older students, that they are taking it seriously. And a lot of that really does depend on what's going on in the household.
Yeah.
I
want to see who all we've got still here on the call, because before we go, a lot of you have been waiting patiently without having said much over the last 45 minutes or so, or even up to an hour, and you've heard a lot. And so, Terrence, what would you like to add here before we say so long, and we'll try and get a few other final thoughts here.
Well, I just want to add that you know, it was said a bit earlier. You know, look, this is less about teaching and learning and more about health and safety. And when I think about my members who sacrificed so much back in March and picked up and adjusted and did extremely well with the online platform, and without having very much time to prepare at all. They did an extraordinary job and really looked at how they can positively affect children with calling home and making sure that they were safe and checking on family members. They did an extraordinary job, and I don't think enough has been said about that. But it was just outstanding to see how much our teachers really love our students, and we're able to sacrifice for them. But also just very cautious about really how this has affected Detroit and Black and brown communities at a disproportionate rate. And we really look at, you know, if it's safe to return to school or should we be online. We really have to look at what the impact has been to our community here in Detroit. We have students that we teach that have lost loved ones and weren't able to mourn them in the way that we traditionally mourn our loved ones. And so we really look at this is going to be an issue relative to our students' mental health, them experiencing a high level of trauma, above and beyond what we've seen with the recent and ongoing issues with police brutality. All of this plays a part in how we're going to safely educate our children and to keep them healthy throughout this experience. This is tough for everyone on all sides of the issue. But at the core, really is the health and safety and the health and safety of our students.
And that takes me back to the point that Paula Herbart with the MEA made early on. Paula, I take it to heart. Terrence is right. When we see how intense it's been felt in places like Detroit and a number of other communities across Michigan, but if I'm a teacher in East Tawas, it's difficult to maybe connect to that passionately. And so I'm curious as to what your thoughts are, given everything that you've heard now over the last hour and a half.
Thank you very much. You know, one of the things that I would say is I think that the pandemic shone a very bright light on the importance of our community public school system, the work that educators do across the board, certificated staff and ESP. We are a constant for many, many children in their lives, and we take that seriously. At the MEA, we talk about the profound trust put in educators to ensure not only that they get a quality education, but they feel safe and they feel secure as human beings. Yeah. And so regardless of whether we're face-to-face, hybrid, part-time remote learning, part-time face-to-face, or all remote learning, we take that very seriously. Educators will they'll remediate, they'll look, they'll assess, they'll ensure, they'll find out where the learning gaps were and where they might be. They'll continue to do the good work. But if one lesson has been learned from all of this, Devin and Paula, it is that public schools make a huge difference in the community. And we know how important it is for students to have those connections with those public schools and everything that they provide for their students.
Yeah, we are so reminded of the way we circulate around our education system. Paula and Terrence, thank you both so much. You guys have been very patient. We'll let you guys go, but thanks so much for being part of our conversations tonight.
Thank you. Have a great night.
You too.
Thank you for having me.
Let's get back to some more questions that we've got from viewers. Barb from Warren wanted to know this. If the governor's order does not allow gatherings more than 10 people, how is it safe for children to be in school? Are they going to limit each classroom to 9 students and 1 teacher? Probably not, I'm assuming. Dr. Viti, you want to take a crack at that one?
I always get the hard questions.
That's
or I'm the only one willing to answer them. So we've actually been asking that question ourselves. As we review the reopening plan, but we've contacted the governor's office about that. And frankly, this is one of those examples of contradiction around many executive orders that have been released that are often contradictory. But the guidance that we have received is that that executive order decision did not apply to schools. Now, I can't interpret that. I can't explain that. You would have to talk directly to the governor or her office or Dr. Khaldun, but that's the guidance that we've been given. And again, I'll continue to repeat, I think it's been said multiple times. DPSCD is not going to make a decision about face-to-face instruction or allowing that to happen in isolation. We trust the governor. We trust her health experts. And if the state health department, through the governor, says that face-to-face is not safe, then we will not allow face-to-face to happen. Yeah. But I think it's important, if the state says it's safe, then I do believe it's important for DPSCD and frankly all districts to offer a face-to-face option.
You know, I think no matter how you cut it, when you think about face-to-face learning and why it's so very important, then you think about the special needs students who really benefit greatly from in-person instruction, really hands-on. Lynn from Livonia asks, what about students with special needs? Online learning is an option for them, but none of the districts, seem to be addressing their needs. They have been forgotten. My son is autistic, and he is not receiving any of the services he is entitled to based on his IEP. What can be done for students like my son? IEP, by the way, is the individual education plan that every special needs student is entitled to for in-person learning under the law. But remember, here's the caveat, in-person learning under the law. That's very, very important. And I just think that's really a great question. Before we get to some of the answers, I do want to take just a little closer look at what families are dealing with right now. As complicated as back to school is for any parent and any student in almost any school district, compound that difficulty when you are a parent of a special needs student.
Here is Sam. Sam has autism.
And while he has good self-help skills, he does require extra help in a school setting.
He has an aide who goes with him, and he has an aide who stays with him during lunch. It's a very small class, which is great, and he does really great.
He loves to pretend to do lawn work.
But for Sam, there is no navigating new normals and routine changes. For him, every day is a labyrinth of various sensory and emotional hurdles to jump. Now, throw things in like masks and hand sanitizer, and the day becomes almost intolerable.
I think it's the feel of something weird on his hands. The face mask, we got him to wear it, like I said, bribing him. For me, it's bribe. For about a half an hour.
His mother, Jennifer, says her district, Allen Park, has not yet provided her with enough information to plan for Sam.
I've asked a lot of questions to a lot of people. I feel like I have, and it has not been addressed. He is in the Allen Park Public Schools autistic program. So when he goes to school, he goes in the autistic room. My concern is that they haven't addressed how they're going to deal with him.
Jennifer actually sees the back to school equation through 3 different goggles: a parent of a special needs child, a parent of a non-special ed child, and a teacher in a different district. Now this spring, it was a juggling act for her to teach her students remotely and handle her own children.
It was a very difficult situation, dividing my time between what they needed, what my students needed, and it was a lot of juggling. I would like some guidance. I would like some help. And it doesn't seem like that is willingly being provided, because this is such an unprecedented situation, which I do understand, but I need help.
You know, this is really tough. This one breaks my heart, because when you think about students, particularly those who are lower functioning, and they actually have a parapro who goes with them from place to place, they need an assistant. They need that hands-on contact with a teacher in order for them to reach their goals. Okay, so we know this is an everybody problem. When it's one child, it's everybody's problem. I don't want to pick on Allen Park. However, Allen Park is in Wayne County, and so Dr. Liepa, I'm just gonna come straight to you. How do you address this? I know we've talked about this in some of our forums with you, but how do you address these parents? Because there's absolutely no way you can send a parapro into their homes. How are these students going to reach their goals?
Well, I'll start by saying what was described by the parents is the real life issues that are happening in families across the state of Michigan and in the country, and it's heartbreaking. I can assure you that special education teachers, principals, and superintendents have this on their radar in regards to a significant issue. We know very clearly that our most vulnerable students are the ones that suffer the most in this type of environment. And so I think you will see different things next year compared to what we saw in the spring when we were in crisis mode. Even if school districts are online, I have heard school districts talk, number one, about bringing in their high need students, their special education students, because they can social distance potentially in the building. While maybe they can't with every student, they can do it with their most needy students. And so I know that's being considered in several school districts. I can't speak to every single one, how they're handling it. The other thing that I would highlight is that when we look at the support for families and kids through this whole process, the IEP process that's out there that school districts have to adhere to, there's this thing called compensatory education that we're also talking about. And that is, we recognize that our special education students actually have lost over this period of time. And we're now trying to figure out, what does compensatory ed look like for students so they can actually get above and beyond what they would get when we're actually able to get school up and going again. So I know those are two specific things that school districts are talking about, but it is a remarkable challenge for our school districts. There is, in some cases, almost an impossible situation in regards to expect the online learning And we feel not just for the students, but for the parents who have a remarkable challenge in regards to supporting their students that have special needs.
Yeah, we know that Rome wasn't built in a day, and you can't rebuild an entire school curriculum in 3 months, particularly when you didn't see it coming, or even 5 months when you really didn't see it coming. But Dr. Liepa, I do want to ask you this, because you're saying that you're looking at these things, but what's the possibility of you even being able to get any of this in gear for special needs students even by October?
I think absolutely school districts are looking at the options that I discussed for the start of the school year, not for the middle of the school year or down the road. So when I mean looking into it, they're trying to figure out the best way to do it. But those are the things that school districts are talking about for the start of school.
Yeah, let us know first. When you do get that piece, do let us know first, please.
And one of our teachers, I believe Elena Larson, wasn't it you that was talking earlier about your worries about special needs students and teachers? This was exactly what you were talking about, right?
Yes, it was. There was a conversation I've had with several people, both in my family, who also either have special needs children, and we also have I have 2 sisters that also teach. So it feels like it's the elephant in the room that we all know is there, but no one wants to acknowledge, because, you know, for some families it's very easy to go online and it makes a lot of sense. But I'm thinking about children that are severely have severe medical impairments. They have tracheotomies, they are in wheelchairs, they are homebound learners. How are we going to adjust this for them to be able to learn safely too? And you know, what we're talking about, you know, some districts, they're doing all online or virtual, but they're asking the special needs teachers to provide face-to-face. I mean, what additional measures can they give those teachers for safety? Because, well, I feel like I do have a choice in my district, because we do have, you know, a very large district and a superintendent that is allowing the teachers to have some say in what our placement might be next year. It doesn't seem like a special needs teacher in that district, especially the parent that was speaking on the segment, has that choice. Because even though her colleagues might be learning online and teaching online, she has to go into a building, and she's also concerned about her student, her child.
You know, I hate to say there are just no easy answers on this, but I do feel like, I think this was kind of like a good date, because nobody got a text message and nobody left. So we lasted a little bit longer. I do want to thank our superintendent.
Let me get one, if we could, just lastly, before we were saying goodbye here. Pam Hornberger, you've heard a lot tonight. As you head back to Lansing now, chairing the Education Committee, is there anything you wanted to add before we go?
It's pretty complicated. Yes. I'm just hoping that we can get to a point where our local superintendents feel empowered to make good choices for their families and for their students, and that we can get everyone, you know, back to school, whether it's face-to-face or virtual or a hybrid, whatever works best for your district. And that we're doing it, you know, in relation to your local health departments and following those safety measures, because honestly, I think they're the people that are going to give us the best answers as far as health and safety, you know, in our schools.
And Dr. Vitti, as the head of the largest district in the state, why don't you put a bow on it for us tonight? Anything you'd like to leave us with?
You know, I would just say at the height of the pandemic, when everyone's fear was the greatest, when the rates were out of control, when all of us, I think, in our own spaces, our own families, were dealing with loved ones who were sick, loved ones who died. A lot of our parents that are in our districts served us. Those were the parents that shelved the grocery stores, the nurses that served us when we were sick.
Very good.
And, you know, I deeply believe that traditional public education is about serving our parents and our communities. And there is legitimate fear and concern about returning. And we cannot return as if we were coming back. We can't look, in schools can't look like they did before the pandemic. But
they won't.
But today is different than yesterday. We know more about COVID. And with the right investment, I think we have a moral obligation to work with our teachers, to work with our parents and our community to serve parents and students where they are now. They were there in their own way when we needed them. And I think as educators, we need to be there for them now. And it's our turn as far as being civically minded, civically responsible and having reciprocity with our community. That's who we are as traditional public educators. And I think we have to figure that out in a collaborative way. We can't start with no, we can't end with no. So how do we figure this out and own collectively this challenge? Because it's not going away. And as we talk about the suffering in the past, we don't want to contribute to the suffering in the future by leaving parents dry.
I'm fond of quoting our second president, John Adams, who said there are two kinds of people in the world, those with a commitment and those who require the commitment of others. We have been joined tonight by many, many people with a commitment. I'm so grateful for all of you being with us tonight. We admire all of you and what you're trying to do, including the students. Thank you all so much for being here, and best of luck in the new school year.
Thanks for hanging out with us. We really appreciate it. This was fun. Let's do this again sometime.
You got it.
Folks, good luck. We know the school year is getting ready to start. This won't be our only town hall. Thanks for sticking it out with us. We appreciate you.
And thank you so much for joining us for this Education for All Town Hall here on Local 4, as we are committed to helping parents, teachers, students, and the superintendents get through this transition into a new school year and what it's going to mean for years ahead.
Absolutely. And Devin, great to see you, even if it's
We've
from
had to
a
be
distance.
apart,
Absolutely.
yes.
Stay tuned. Of course, we have lots of reports on Local 4 and right here on clickondetroit.com. Thank you so much for staying with us. Be safe, remain well. Good night.